Hey, Dr. John here. Just want to go through my laser presentation. I'm giving a talk to a stroke support group tonight, so I thought it'd be beneficial to record this. That way, if any members are not there and they want this information, we can get this to them. So, uh, Dr. John Pachorik, cold laser therapy and brain health. That's the topic today. So I'm John Pachorik. I'm a chiropractor. I'm a functional medicine doc. I love to do cold laser, a lot of nutrition. I went to Wright State University in Dayton, Ohio. Got my Bachelor of Science degree from there in biological sciences. Studied marine biology at Duke University. I went to New York Chiropractic College for my chiropractic education. Became a doctor of chiropractic. Moved back to Springfield, started working as an associate, had an associate chiropractic, and then about 2 years after that, my wife and I bought the practice, associate chiropractic, and we loved it. We love doing the adjustments. It was basically a pain clinic at that time, so we've really transformed it to a holistic healthcare office. But in the early days, just kind of knew we always wanted to do more, so we enrolled at Functional Medicine University and became functional medicine practitioner, certified functional medicine practitioners. Just a lifetime learner. Love reading, love educating myself more just to help my family, help the community. We rebranded to Harding Holistics maybe 2 years ago, just to better encompass what we do and all the holistic services we offer. So that's just a picture of me with the practicing what I preach, putting the laser on my brain and getting the benefits for me. I love to actually do laser therapy myself on my brain. I do Spanish lessons a couple times a week, so I try to get the laser when I'm doing Spanish. Just helps keep me more focused. I feel like I can get through an hour lesson without fading. Before I started playing around with the laser in my brain, I don't know, I make it 35 to 45 minutes and just start, fading, just getting tired. So, I definitely have noticed some good benefits myself. Here's my family. So this was the Outer Banks, June of this year. A lot of people know where we're at in this picture, but this is really why I do what I do, just to create this beautiful, strong family. Make sure we're living a very holistic life, practicing what I preach. But my youngest daughter there, the one with the pink hat in the middle, when she was about 2 years old, she had a traumatic brain injury. We were just goofing around, doing the surprise boo. She'd run away, come back. But long story short, she slipped on hardwood floors and hit her orbit on the bottom step. So she broke her orbit, probably had a bit of a concussion. So, we evaluated her, got her some great treatment right away. This was before I had laser therapy. And so we just knew too much sugar would trigger her, certain other things. And we always joked that she was kind of like our Dr. Jekyll, Mr. Hyde child. She could be having a great time laughing, and then the next second just kind of snap and be angry. Really, all that changed when I got the lasers. So I've been doing the lasers in my office for about 2 years. Actually, this December will be 2 years. So she's been a big-time beneficiary of the laser therapy. But really, once we started doing that, her personality has changed. She has a lot more control. I don't see the split personalities as much. Every once in a while, if the conditions are right, a lot of sugar, a lot of stimulus, we're not getting our supplements, we're staying up too late, those types of things. But overall, it's a night and day difference. So really, we can thank her a lot for me incorporating the laser into the office. So cold laser therapy, lots of peer-reviewed research. So just looking at the National Library of Medicine, if I put laser therapy in, that's a top right picture there, you get about 109,000 results. So that's everything from laser hair removal to cold laser therapy like I do in the office to laser surgeries. But cold laser therapy has a lot of different names. It goes by a lot of tags. It's also known as photobiomodulation therapy. That's where you're going to see a lot of the research, photobiomodulation therapy, at least the research that concerns what I do in my office. Low-level laser therapy, just laser therapy, laser-level photobiomodulation. So the bottom picture there on the right is photobiomodulation therapy, and you still get about 9,200 results. So lots of peer-reviewed research articles about the benefits of laser therapy. Now, how do I use it in my office? every different way I can. So use it on all ages. I really think everyone can benefit from the laser therapy. Everything from acute injuries to chronic injuries, brain health, which is the focus of this talk, inflammation, wound healing, skin conditions like acne and eczema, gut health and pain and autoimmune conditions. I mean, the list goes on and on. I really try to get it on everyone. I use it on myself first. I always test everything on myself, on my family first. Just the benefits I saw were amazing. And then we start bringing it in the office, and it just blows my mind every day. We get all kinds of fun stories, miracles in my office every day. So what is cold laser therapy? So cold laser is a type of phototherapy designed to repair tissue, reduce pain and inflammation, target fat, and provide other benefits in both medical and veterinary treatment. So cats, dogs, horses, animals get benefits from this cold laser therapy as well. Now, I don't do any of that in my office. That's what vets do, but they have the same lasers for veterinary settings. The capabilities of low-level lasers have been used for over 50 years, so it's not anything new. That's what blows my mind. Every day we get patients in the office and they think it's a brand new high-tech device, but really this has been around for years and years. So it's revitalizing. Cold lasers stimulate all types of cells, including muscle, ligaments, nerves, and cartilage. Now nerves, I love that because nerves and brain tissue are very slow-healing tissue. So if we can target those and get some healing effect there, it's miraculous. Cellular boost, so the stimulation of light energy works similar to photosynthesis in plants. Now I'll get into a little bit more complicated biochemistry, but this is kind of the simple summary. So works similar to photosynthesis in plants as it is absorbed and interacts with light-sensitive components in the body's cells. So it's natural healing. Treatment promotes the body's natural healing, which I'm all about. We want to be holistic. We want to be as close to nature as possible. So the body's natural healing, which may have been impeded through tissue damage. So by stimulating mitochondria and encouraging the cells to produce more ATP. It's non-surgical, so it's non-invasive. It's low-intensity therapy. Cold laser therapy can be performed in an outpatient clinic, which is what we do in my office, providing a distinct advantage over traditional laser therapy. So this is one of my lasers here. It's a red and violet laser. Here's a couple more of mine. So we've got a green and violet, red and violet. Now they both work very similarly. When you come to the office, you'll notice I rotate through. The green stimulates things a little differently than the red laser, so I just like to rotate those through. I can't say I see more benefits with one over the other. I just try to rotate them through and make sure I get both color lasers on you. Well, really three, because we get the violet laser as well. So green and violet or red and violet. So let's talk about brain health. So what does the research show? Specifically, cold laser therapy for brain health. So here we go. National Library of Medicine again, photobiomodulation therapy and stroke. I got 98 results there. So once again, it's been researched since the 50s. This here is just over the past 22 years. So we got 98 results over the past 22 years. So this first article I've chosen to put in here, I like it, one, because it's a 2024 article. This is brand new research, actually June 2024, photobiomodulation therapy on brain, pioneering an innovative approach to revolutionize cognitive dynamics. So journal articles have lots of fancy names, they do a lot of statistics, so you got to dig through them and really find the nuts and bolts of everything. So I tried to summarize things as easily as I could. I liked starting with this article because this gives us a little bit more of the biochemistry, a little bit more of how the lasers work. So I'm just going to read this highlighted section. So photobiomodulation therapy on the brain employs red to near infrared light to treat various neurological and psychological disorders. So now we can also say green laser as well. The mechanism involves the activation of cytochrome C oxidase in the mitochondrial respiratory chain, thereby enhancing ATP synthesis. Additionally, light absorption by ion channels triggers the release of calcium ions, instigating the activation of transcription factors and subsequent gene expression. This cascade of events not only augments neuronal metabolic capacity, but also orchestrates antioxidant, anti-inflammatory, anti-apoptotic responses, fostering neurogenesis and synaptogenesis. It shows promise for treating conditions like dementia, stroke, brain trauma, Parkinson's disease, and depression, even enhancing cognitive functions in healthy individuals and eliciting growing interest within the medical community. So a lot of big terms there for the doctors that are watching this or I'm sure you know what that is. We'll break that down. This article is fantastic because it has some great infographics that go with it that are my next few slides. So it breaks things down a little bit better for us. But I love how it talks very scientifically on the effects of putting the laser on the body, how it affects the cells. So here we go. So here's a first picture. Once again, this is from that journal article in Cells. You put the laser on the brain, you get increased blood flow, reduced oxidative stress, promote angiogenesis, which is new blood vessel formation. It inhibits inflammation, neuronal inflammation, which is fantastic. So let's squash that inflammatory response. It inhibits apoptosis. It increases progenitor cells. It promotes neurotrophic secretion, increases synaptogenesis. So it creates a lot of new connections. Just the benefits of putting a light on your head for 5 or 10 minutes is amazing. Here's just another picture from the same journal article. So once again, laser on the brain. This shows kind of the biochemical trigger of events that occur. This is another infographic. I love it because here we're talking brain disorders. So we have traumatic, neurodegenerative, psychiatric, neurodevelopment. So it says types of brain disorders susceptible to potential treatment via transcranial photobiomodulation. So we've got on the traumatic, we've got acute stroke and chronic stroke. We've got traumatic brain injuries. Neurodevelopmental, we've got autism, ADHD, psychiatric, we've got depression and addiction and insomnia. It's amazing to me. Neurodegenerative, we've got Alzheimer's disease, Parkinson's, dementia. Just a whole world of disorders that it can help with. The second article I have is photobiomodulation for traumatic brain injury and stroke. So this was a 2017 article published in the Journal of Neuroscience Research. So this article says there is a notable lack of therapeutic alternatives for what is fast becoming a global epidemic of traumatic brain injury. Photobiomodulation employs red or near-infrared light, 600 to 1100 nanometers, to stimulate healing, protect tissue from dying, increase mitochondrial function, improve blood flow and tissue oxygenation. Photobiomodulation can also act to reduce swelling, increase antioxidants, decrease inflammation, protect against apoptosis, and modulate microglial activation state. So once again, kind of repeating of what the previous article showed. All these mechanisms of action strongly suggest that photobiomodulation delivered to the head should be beneficial in cases of both acute and chronic traumatic brain injury. So you don't have to just have a traumatic brain injury and 10 seconds later get the laser on you. This can be a concussion from years ago. It could be an injury from years ago. You're still going to get benefits. Most reports have used near-infrared light either from lasers or from light-emitting diodes. Now the difference between a laser and a light-emitting diode is depth of penetration. So the research shows that a laser you're going to get a deeper penetration. So it'll get deeper into the brain tissue. Many studies in small animal models of acute traumatic brain injury have found positive effects on neurological function, learning and memory, and reduced inflammation and cell death in the brain. There is evidence that photobiomodulation can help the brain repair itself by stimulating neurogenesis, upregulating brain-derived neurotropic factor synthesis, and encouraging synaptogenesis. In healthy human volunteers, including students and healthy elderly women, photobiomodulation has been shown to increase regional cerebral blood flow, tissue oxygenation, and improve memory, mood, and cognitive function. Clinical studies have been conducted in patients suffering from the chronic effects of traumatic brain injury. There have been reports showing improvement in executive function, working memory, and sleep. Functional magnetic resonance imaging has shown modulation of activation in intrinsic brain networks likely to be damaged in traumatic brain injury. Fantastic research here. The next article I have is the beneficial role of photobiomodulation in neurodegenerative diseases. So this one's interesting because this talks a lot about Alzheimer's, Parkinson's, traumatic brain injury, stroke, epilepsy, depressive disorders. I'll read a little bit from the abstract here. Once again, it talks about photobiomodulation. I feel like we've got the nuts and bolts of that by now. So this, let's see, this is a June 2023 article. So the available therapeutic drugs have only been able to provide symptomatic relief and may also present with some side effects, thus precluding their use in treatment. So this one starts talking about the pharmacological drugs they use for treatment management of these conditions. So recently there has been an exponential increase in interest and attention in the use of photobiomodulation as a therapy in various neurodegenerative diseases in animal studies. So in this article here, we highlight the various ways by which photobiomodulation may possess beneficial effects on neuronal activity and has been reported in various neurodegenerative conditions: Alzheimer's, Parkinson's, epilepsy, traumatic brain injury, stroke, with the hope that it may serve as an alternative therapy in the management of neurodegenerative diseases because of the biological side effects associated with drugs currently used in the treatment of neurodegenerative diseases. So as I thumb through the article, it talks about what they found with Alzheimer's and Parkinson's, traumatic brain injury. Stroke is right here. So they give the definition of stroke. A stroke is classified as a cerebrovascular accident and presents a significant socioeconomic burden on the sufferers of this condition. So this is the journal references this. Nasser et al. Had earlier reported the significant benefit of transcranial photobiomodulation in stroke. So this article's pulling other research from other articles showing that light therapy, photobiomodulation, laser therapy is very beneficial. In a recent case study by Stefan et al., laser photobiomodulation was proven to show significant improvements in stroke and aphasia. So aphasia is just another big word, but it's the partial or total loss of the ability to articulate ideas or comprehend spoken or written language, typically resulting from damage to the brain from injury or disease. So laser therapy is showing to be beneficial with this. And at the end, I'll show you kind of how I figure out where to put the laser on different patients, kind of what we're looking for. This next article shows photobiomodulation with superpulse laser. So photobiomodulation with superpulse laser shows efficacy for stroke and aphasia. So once again, aphasia is that partial or total loss of the ability to articulate ideas or comprehend spoken or written language. So this one is from the World Journal of Neuroscience. This is a 2023 article. So I also tried to put a hyperlink so people can easily find these articles, so they know I'm not finding buried articles. They're right there in the research. So in this one, the results were patients showed significant improvement in their ability in their speech and verbal skills. Improvements were also noticed in walking ability, limb movement, less numbness, and better vision. Their conclusion in this study was the use of photobiomodulation in stroke rehabilitation deserves to be tested in controlled clinical trials because this common condition has no approved pharmaceutical treatment at present. So interesting. So 4 articles right there benefiting the use of laser therapy on the brain. I mean, just fantastic. So this is how I figure out where to put the laser and how to best serve my traumatic brain injury patients, my Parkinson's, my stroke patients. This is a brain region localization form. It's not mine. I didn't invent it. It's from Dr. Dadis Kodarazian. It's 100 questions. You rate them from 0 to 4, 0 being I never have symptoms, 4 being I always have symptoms. And basically, I like to have the patient fill it out because the patient is going to have different priorities than perhaps someone that's close to them. So I like to have the patient as well as the caregiver fill this out so we can make sure we're taking care of all levels of priority. But it'll rate everything from and help me really direct the laser to where we want it to be. Do we want it more on the frontal lobe? Do we need it more on certain motor areas? Do we need it on like Broca's area, deeper in the brain, that helps control speech? Do we need it more on the cerebellum, which is kind of like it helps with balance and coordination? So I like to do this pretty close to initiating treatment so we can help localize the area. We also take a pretty good history. I like talking. That way we get the full idea, the full scope of what's going on, and can best help people out. So that about sums it up. this is kind of our office logo, Expect Miracles. My grandfather's a chiropractor, and so whenever I would go to his house, my grandmother would always ask, John, what kind of miracles are you seeing in the office? She just always saw those chiropractic miracles. So we don't really look for them anymore because they just happen. So we got this slogan, this phrase, just expect miracles, because when we remove interference from the body is very magical and it wants to heal. So any questions, my website is there. That's my personal email, so feel free to email me. I'd love to help you out. Hope this was informative, at least get you scratching your brain a little bit, get you thinking, maybe dive into the research yourself and see how photobiomodulation therapy or cold level laser therapy can help you. Thanks for your time.